Morena. My name is Christine Ozolins, and I'm Chief Science Officer at Exsurgo. Today, I would like to talk to you about our Axon neurofeedback system and its application for treating chronic pain. Chronic pain is associated with a wide range of symptoms, including sleep dysfunction, mood disorders, quality of life deficits, environmental and social challenges. The biopsychosocial model of chronic pain shows the interrelated factors that contribute to and are attributes of the chronic pain disease state. It is important to note that the processes underlying chronic pain are not conscious. Brain regions involved in chronic pain are also involved with a diverse range of behaviors, including memory, attention, emotional regulation, stress response, circadian rhythms, and homeostatic processes. Over time, neuronal activity changes the way the brain predicts and responds to pain, resulting in structural changes and functional alterations in large networks of activity. Brainwaves are produced by synchronized electrical impulses resulting from large groups of neurons firing and communicating with each other. When they fire, they produce rhythmic fluctuations traveling across brain regions, known as neural oscillations. These oscillations fluctuate and interact across specific frequency bands associated with different neural networks. People with chronic pain can often have suppressed activity in alpha, often accompanied by heightened activity in theta and high beta. This means that they are spending less time in the relaxed alpha state and more time in the theta frequency, often due to medication or poor sleep, and also in high beta, which is the top end of the beta frequency band and is associated with anxiety, overstimulation, and fight or flight responses. Chronic pain can be difficult to treat. Pharmacological treatment strategies are frequently associated with side effects and a risk of dependence, tolerance, and misuse. Non-pharmacological multidisciplinary treatment protocols appear to be the best way forward, but these can be costly and difficult to access. So can we do something to help break this cycle of chronic pain? Can we help redirect maladaptive brain activity to more normal patterns of function? EEG-Neurofeedback is a non-invasive technique that allows unconscious processes to become observable, allowing a person to consciously interact with their own brain activity. Neurofeedback allows modulation of EEG activity in areas of the brain associated with a particular disease or behavior. In this case, pain perception and regulation. Neurofeedback uses the principles of operant conditioning in order to facilitate neuroplastic learning. Repeated application of neurofeedback training can cause increased neural activity in targeted areas. Increased and consistent firing at these targeted areas can strengthen existing neural pathways and create new ones. So you might be wondering why you haven't heard about neurofeedback before. Well, it has been around since the 60s, when a NASA researcher stumbled upon it as a treatment for epilepsy. However, the research funding was cut and neurofeedback disappeared for a while, ending up in university labs with limited academic funding and clunky, expensive equipment, or in high-end clinics with prohibitive price tags. Until now. The advent of neuroimaging evidence has shown us how neurofeedback works in the brain. Plus, advancements in Bluetooth technology have given us the ability to stream large amounts of EEG data. High processing speeds in modern mobile devices, such as a tablet, allow online processing of raw EEG signals in real time. Ease of integration between mobile apps and cloud service providers allows for secure data upload and storage. 3D printing plastics allow for rapid iterative design, which is essential for generating a robust design that can conform to various head shapes and sizes. And portability. It is now possible to do EEG neurofeedback at home. So how does the Axon system work? Using the headset and app, the patient performs 5 to 6 sessions a week for 8 weeks. They choose from a selection of games, which allows them to interact with the unconscious processes regulating their neural activity. Over time, the brain naturally learns to access these processes automatically, a bit like learning to ride a bike. This allows a person to retrain their brain to spend more time in a particular state. Here is an example of one of the games used to allow patients to interact with their brain activity and to modulate their alpha frequency. After taking a baseline, The threshold is set for the session, so that's resting state alpha plus 10%. Every time the patient goes over the threshold, the game starts to work, and when they stay over threshold for 0.75 of a second, they hear an audio tone. So they get visual feedback for being in the alpha state, and they get audio feedback for maintaining that state, encouraging sustained neural firing in the alpha frequency. So obviously we have to test the Axon system with chronic pain patients. To start with, we conducted a proof of concept study in the UK. We had a small patient population with varying types of chronic pain. We went into lockdown just before the trial started, but the silver lining was that we were able to test the concept of the home use system. Patients completed 32 to 48 sessions of around 45 minutes over an 8-week period. Symptoms were assessed pre, post, and at 4 and 12-week follow-up, so we could assess if any changes lasted beyond the intervention period. Weekly reports were also conducted to check on safety and usability, and post-intervention qualitative interviews were conducted. Patients reported clinically significant improvements in pain pre to post-intervention, with a 36% mean decrease in pain intensity. There was a slight raise at 4 weeks and then a slight decrease again at 12 weeks. But as you would all know, pain scales are a blunt instrument, not a very reliable way of measuring chronic pain. The group had clinically and statistically significant improvements in central sensitization, pre to post intervention, and maintained at 4 and 12-week follow-up. Importantly, they moved from severe to mild according to the central sensitization inventory. One of the most remarkable results of the trial was the improvements in sleep, which we know is intimately involved in the maintenance of the chronic pain disease state. Patients reported clinically and statistically significant improvements in sleep across the board, with a 54% mean improvement pre to post intervention, which continued to improve at 4 and 12-week follow-up points. Patients reported improvements in anxiety symptoms pre to post intervention and continued to improve at 4 and 12-week follow-up, moving from borderline abnormal to normal rates of anxiety. For depression, there was a statistically significant improvement in symptoms pre to post intervention, with the group mean moving from borderline abnormal to within the normal range. The weekly reports gave us rich data and insights on training strategies, Axon usage, and the impact of COVID-19 on their chronic pain. Participants reported that the training had helped them during lockdowns when they were unable to access their regular services, such as physio appointments. This was striking because this was a time when chronic pain patients all over Europe were getting worse, whereas our participants reduced their pain, improved their sleep, mood, and quality of life, and also reported increased resilience, pre to post-intervention, and at 4 and 12-week follow-up. Over the course of the intervention, we typically saw changes in patients' EEG, suggesting we had induced neuroplasticity. This example shows an upregulation of relative alpha and a downregulation of relative theta and high beta. This patient reported improvements in pain, mood, sleep, quality of life, and a reduction in pain medication. Across the trial, 82% of the patients who reported improvements in pain also upregulated their alpha. 75% of those who reported improvement in anxiety and 83% of those with improved depression scores downregulated their high beta and theta. The UK study was great for showing us the feasibility and efficacy of the Axon system, including its ease of home use. However, there were significant limitations, not least of which were the small sample size and lack of a randomized control group. However, these limitations are now being addressed with a larger trial. Our New Zealand trial is currently underway, recruiting participants from Auckland and the Upper North Island with a wide range of chronic pain conditions. It is a double-blind, randomized, sham-controlled study, the largest of its kind in the world. The trial is split into 2 parts. In part A, we are measuring the short-term efficacy of 8 weeks of home-based EEG-Neurofeedback versus 8 weeks of sham. In part B, we will assess whether neurofeedback booster sessions over 12 months enhance the long-term efficacy of neurofeedback training. And it is a mixed method study. Subjective outcomes measures looking at pain, central sensitization, sleep, mood, pain catastrophizing, quality of life, and global impression of change will be assessed pre, post, and at all follow-up points. Sleep and heart rate variability will be measured during the training period with the Aura ring. Changes in EEG activity will be measured throughout the intervention where training takes place. A qualitative study is also being conducted with questionnaires at week 0, week 6, and one-to-one interviews with a selection of participants from both the experimental and sham control groups in week 9. This is the first study of its kind in the world with such a large sample size, wide range of chronic pain conditions, and comprehensive outcome measures, including matching EEG activity onto study outcomes and mapping qualitative data onto quantitative outcome measures. And we couldn't do it without these guys. We are fortunate to be working with some of the leading pain specialists in New Zealand, David Rice from AUT and Michael Kluger from WDHB. We hope to have interim results available later this year. You can find out more about Richard, Faisal, Jiva, John, and the rest of the Exsurgo team on our website. Thank you so much for listening, and I hope you have a wonderful conference.